Hello, I am Dr. Bernestine Taylor, Medical Officer for Disease Control and Prevention in the Alabama Department of Public Health. I'm pleased to have the opportunity to introduce this information on tuberculosis and talk about World TB Day. Each year, this date is a worldwide celebration to increase community awareness about tuberculosis. The key message of World TB Day is clear. TB is preventable, treatable, and curable with the right care. Early action not only saves lives, but can also protect families and communities from further spread. I will mention tuberculosis theme, the call to action, while we celebrate on March 24th, the number of people who have been affected by TB in the world, the United States, and Alabama, the cost of tuberculosis, and more information to come. The theme for this year is Yes, We Can End TB. The theme is different every year, and it highlights our urgent need to find out early if you have tuberculosis. The theme also is a global or worldwide theme. It's not just an Alabama theme, and this theme acts as a call to action for governments, healthcare providers, communities, individuals, states, and renew their commitment to end tuberculosis. Why do we celebrate March 24th? Well, that was the day that Dr. Robert Koch, who was a German physician and microbiologist, discovered the germ that caused tuberculosis, and that was in 1882. 100 years later, in 1982, the health community decided to commemorate him and honor him every year on that day. So, what is tuberculosis? Tuberculosis is caused by a germ that affects the lungs usually, but it can also affect other parts of the body, the brain, the kidneys, the ovaries, the spine, for example. It can affect multiple parts of the body at the same time, and it can be cured with timely and adequate treatment. However, delayed or no treatment can cause great sickness and sometimes even death. And a lot of people are pretty much surprised that tuberculosis is still around, but it's actually very prevalent. In 2024, there were 10.8 million people who developed tuberculosis in the world, and 1.2 million people died. In 2024, there were 9,615 cases in the United States with 565 TB-related deaths. In Alabama, 2024, there were 90 cases and 3 deaths. 2025, 89 cases and 5 deaths. Since January 2026, there have been 13 cases and no deaths. So the Alabama numbers seem small compared to the global overall numbers, but we have to remember that our Alabama numbers are counted in that worldwide number. At ADPH, or Alabama Department of Public Health, our goal is elimination of tuberculosis in Alabama. We provide testing, treatment, and case management for all persons, regardless of their ability to pay. That is our contribution to this worldwide problem. It costs a lot of money to treat tuberculosis, and even more when it's left untreated or if treatment is delayed. Treatment per patient can cost anywhere from $1,200 to $3,800, and some patients have a very resistant or very hard to treat case of tuberculosis that requires longer treatments and very expensive medications. It would take about $5 billion a year for the needed research for us to get new drugs and new treatments to end tuberculosis. In Alabama, hospitalization can cost up to $14,000 per person. So overall, this devastating number of sick patients, cost of treatment, hospitalization, and sometimes the cost of life, all of these are clear reasons that we need to do our part in Alabama to contribute to the overall global and world goal of ending TB by 2030. So in this series, you will have more information and more details about tuberculosis. You will hear from a patient's perspective what it's like to actually have tuberculosis. How do you get the diagnosis of tuberculosis? Understand the difference between an inactive form of tuberculosis and an active form of tuberculosis. And also understand and hear more information about tuberculosis in children and pediatric and also in pregnant women. And after tuberculosis, sometimes people have lung disease, and you will hear more information about that also. So I urge you to stay tuned and get more information on tuberculosis and understand that yes, we can hashtag end tuberculosis. Thank you for your time and attention.